Jefferson is really using technology in new ways to reach out to the patient or consumer. Can you talk a little bit about what your global strategy is there?
Yeah, so we decided at Jefferson, we're a 190-year-old institution, number 17 hospital system in the country, but we decided that the real key is going to be how do we really connect with patients at a different level? I mean, think about this. Patients do everything on devices like this except for health. So we just decided we were going to redefine Jefferson as the place where tomorrow's healthcare happens today.
And what are some of the innovations you're leading, telehealth being one of them? Can you describe how you're approaching that?
Yeah, so we don't look at it as much as telehealth as we look at really creating what we call patient-provider stickiness. How do we have people starting from home think about Jefferson, whether it's wellness or a problem they're having or deciding what their next healthcare visit is? So telehealth becomes one very, very important piece to that.
Can you describe a little bit about what you're doing?
Sure. So what we've done is we've partnered with a company called American Well, who has really been one of the leaders in telehealth. And we're looking at all the things that don't make sense in the current hospital or healthcare environment. The two things we're starting out immediately, virtual rounds. Think about this. Your mom's in the hospital. Did the doctor make rounds? Yeah, I was half asleep. Okay, well, could the doctor call me? No, the doctor's busy in the ER or OR. Now, at Jefferson, you'll be able to doctor will press a button, you on your iPhone, on your iPad will be able to participate in those rounds.
So what's the goal of that? Is it to just get better family involvement in that? Is it better patient involvement?
Well, you think about, we always talk about the triple aims of cost, access, patient satisfaction. All three of them get involved. We want patients to feel that they and their family are involved in their care. So the ability to know that when your mom or dad is being discharged, you know what's going on is important. The second thing we're doing, which will be a little later this fall, is virtual discharges. I mean, think about readmissions, a place like Jefferson, which does tertiary and quaternary type services, and then goes back to a family physician in a rural area. Now that family physician will have all the discharge instructions archived, or could be part of the whole discharge team when we talk to the patient. I believe the number one problem in readmissions and continuity is communication, and telehealth is a great vehicle for communication.
So in something like the virtual rounds, what are the logistical challenges you have to overcome to do that? Make sure that the family members by the phone, for instance, things like that?
Well, the first thing you have to do is have a willing physician complement. And we've hired an individual named Dr. Judd Hollander, who came from University of Pennsylvania, his whole team that has really started to go around to our hospitalists and other physicians, getting them excited about it. Then we'll have an advanced team that literally makes sure right before they go to the next room that everything is set up. And again, like any other technology, we'll do it as a pilot to begin with. But the fact is, the technology exists. It's just been getting the doctors and nurses' willingness to make that part of the rounding experience that really has to change.
So it seems like some of the things you're doing are a little bit ahead of where the rest of the field is. Is it your philosophy to sort of get out in front of where the field and technology even is at this point?
My hero was Steve Jobs, and I think one of the great things about Steve was he was able to think what's going to be obvious 10 years from now and do it today. It is absolutely clear to me that 5 years from now even, we won't be using this for trips and for travel and for shopping and everything else. One of my friends said, it's amazing that I can, the day after Thanksgiving, do all my holiday shopping in my pajamas watching Game of Thrones, but if I have a stomach ache from Thanksgiving, I got to wait on the phone and then wait 3 hours to see a doc. There's no chance that's going to happen.
You mentioned the physician component of this. How do you get them on board with more use of technology, more use of telehealth? What are your plans to really get them involved?
So the first thing is that we've made a big deal to our physicians about what we call the new math. If you're running an academic medical center today, it's NIH funding, oop, that's going down. Clinical reimbursement, ooh, that's going down. Tuition, can't keep increasing tuition. So we've created a whole new organization around the new math, which includes innovation and philanthropy. So we actually have our CEO of our innovation pillar is at the same level of our provost and the CEO of our clinical pillar. So what starts to happen is physicians feel that they can actually be optimistic about the future because of these innovations.